For those who've just been told they've got cancer, it is a huge emotional change. Many things happen.
The significance of supportive care, that having a hammock, if you like, something which holds them up, lifts them up, will actually improve the healing process. I think that's what supportive care is all about.
It makes me reach the stage that I feel better or recover from that faster.
Just knowing that you can trust the care that you are given, I think makes or break it, because you can either go, I'm not coming back ever here, or you can go, I trust the system totally.
Okay, it's going to be a tough day, but I know that the people I meet are going to be able to try and help me. It may seem quite small, but I think it is what makes a difference between someone turning up to the hospital.
You're 140 k's from the hospital. Petrol's very expensive. Public transport up here is rubbish. If you've got a family sort of thing that can take you in there, it's not so bad. You've got someone to talk to on the way. But when you're sitting in that train, you're going somewhere you don't want to be going. It's a long way.
Doesn't cancel out the need for all that professional care. It simply is the thing that holds the consumer up while that care is being given. If support's available, that should be some of the basic information you get from, day one.
I think it needs to be an ongoing ask. It cannot be just in one point in time.
Cancer patients live with the repercussions of their cancer diagnosis and treatment very often for the rest of their lives. So whilst the acute phase needs a listening ear and needs an observation and an understanding of a patient's supportive care needs, there are also needs that follow them home.
When I walked out of the hospital, it was pretty warm. I had bad clothes and stuff, and my head of course was swollen, and I got to the station. I thought, am I going to make this? First week home was terrible.
It's terribly important for people to know what's out there and to be able to know how to access it. That's the more important thing.
It's pretty hard when you're on your own. Even to talk to someone sometimes is enough.
If the care that you feel you need is not offered to you, it's pretty intimidating. It's pretty intimidating to come in for a treatment or to go to clinic or whatever it happens to be and sit there feeling before you go in, wow, there's this issue that I'm having, I'm not able to solve it. There must be something that can be done. Please help me, point me in the right direction.
Point me into the right direction of where I should be looking at for other matters, be it health or non-medical related.
Look at the person behind the diagnosis and spend the time, even if it's 2 minutes, spend the time just, hearing who they are.
Everyone who comes into contact with that patient needs to be mindful of their needs and their requirements.
I think it's very important that healthcare professionals recognise that there are support services that should be referred on to patients.
No one should have to ask for these things. These things should come as of right. These things should come automatically.
I shouldn't have to be lucky. There's a lot of people out there probably don't even ask or don't know or aren't fortunate enough to have a doctor that said, we can help you.